So what are the pillars of medical ethics or the medical principles? Sometimes when they talk about pillars of medical ethics or medical principles, they are the same. So some of those pillars or some of the medical principles we have, there are 4 in particular. We have respect for autonomy, which is the moral right to choose and follow one's own plan of life and action. Then we have beneficence, which means do good. And then, non-maleficence means do no harm. And then justice, which is the fair distribution of social and medical resources. No worries, you're going to see these medical principles in detail in my next slide. So the above principles are balanced and weighed in any ethical issue. So when they come into conflict and an ethical dilemma occurs, leading to a need to make a decision about which principle is the most important in that situation. So the first principle we saw was the respect for autonomy. So autonomy is the patient's choice and control or ability to decide. And it is dependent on informed consent and accurate information. When you want a patient to decide on what to do on or about his or her treatment, you have to give them accurate information. Don't lie to them because you want them to accept your suggestion. Give them accurate information, and then let them make an informed consent to what you explain to them. And also, this respect for autonomy requires excellent communication. That's why we took you through. I took you through the communication skills. You need to excellently communicate to this patient so that they can understand what you are telling them, and it will help them to make a decision. And when a patient makes a decision, that is patient autonomy, and we have to respect their decision, so long as they are conscious and are coherent enough to decide on what to do for them. So autonomy also needs trust and truth telling. Don't lie to patients when you want them to accept. When you want them to decide on what to do for them. So in most simple terms, autonomy means that people should be free to make their own decisions and choices in life, even if this decision may seem irregular to other members of society. So long as these people are conscious and they have understood what you've told them and you've been truthful to them, you've given them accurate information, and they decide other way, we have to respect their decision and go by what they have decided. So in clinical practice, this means that patients should be allowed to make decisions based on their own beliefs and values, while some choices made by patients do not always correspond with what the professionals believe is the right choice for them. If the patient has been given sufficient information and is clear about their decision, with no external pressure, the healthcare professional is bound to respect the decision. You are bound to respect the decision. Don't say, if you refuse what you told them, sign here and go, and then you start intimidating the patient. Please don't intimidate these patients. Your role is to explain to them. Explain what the benefits of what you are talking about, and then the disadvantages they don't accept, and let the patient decide for themselves. I put an example here. The Jehovah's Witness. Most of us have heard about the Jehovah's Witness. What do they believe in, class? And maybe some of us here are Jehovah's Witness. What do they believe in? These Jehovah's Witnesses don't believe in blood transfusion. These Jehovah's Witnesses don't believe in eating anything that has blood. I think they're vegetarian. So I'll tell you a scenario. When I was working at Nsambia Hospital in a pediatric ward, we got this 8-year-old boy who was a twin, and he was a sickler. So he came in painful crisis, and he was anemic, totally anemic, and his HB was 3. So the doctor at OPD ordered for an immediate blood transfusion. When the boy was admitted on our ward, I was the staff on duty. And when I saw HB3, I didn't even send students. I ran to the lab to bring blood because the samples were already taken off from OPD, the blood for the booking and postmart. I ran to the lab. I told them it's an emergency. I need blood urgently. I left the boy in the treatment room. The boy came in with his dad. The boy was a twin, and twin sister was left at home. So the mother stayed with the twin sister. The dad came with the twin brother. So good enough, lab acted so fast, and they gave me blood, 2 units of blood. I came running to the ward to transfuse. And as I was trying to hang the blood up, the father of the boy told me, "Excuse me, sir, what are you doing?" I said, "Actually, because it was an emergency, I had even forgotten to explain the procedure to the patient or to the dad. I told him, your son is 2K2 anemic, so the doctor has ordered for blood transfusion, and we are going to put these things on him to run so that he can save his life." And the man said, "Over my dead body." He said, "In store, you can't transfuse my boy." I said, "But why? The only thing that can save his life is blood transfusion." He said, "Over my dead body, don't transfuse for us. We are Jehovah's Witnesses. We don't believe in blood transfusion, and you can't transfuse my boy." Oh, I felt so bad. Then I had to call the senior doctor, and I told him this second the dad has refused the blood transfusion because they're Jehovah's Witnesses. The doctors all came, the senior nurses all came, and they pleaded to the man to allow the blood transfusion. The man, "There is no transfusion. If you want to save my boy, put IV fluid, but not blood." So as we were there pleading for a transfusion, the boy started gasping, and eventually the boy died. I felt so bad. And when the boy died, the man said, "Oh, at least my son has died in the Lord." Everyone felt annoyed. I went to one of the rooms and I started crying. I felt so bad that this boy had lost his life, yet we could save his life. And we lost that boy. Just imagine if we had insisted and transfused this boy, and then he eventually died, not because of the blood, but because of his condition. And he eventually died. So this is an ethical dilemma, because what you are doing for this boy is the right thing to transfuse the boy. But on the other hand, the father is saying no transfusion. So what would happen if we would be pushed and transfused and the boy eventually died? Don't you think that if this man was a well-off man, he could sue us for killing his son? And what if the boy had not died and he had saved his life? What would the man say? If we had transfused and the boy doesn't die, what would the man say? That was an ethical dilemma. The other scenario, I was working in Syria and finding that neonatal ward, and we got this lady who was for surgery. He had multiple uterine myoma, and they were so huge that she needed transfusion when on table and after surgery. So the doctor explained to the lady, she was an old lady, but she said, "No transfusing me." And she signed down, no transfusing her. But then the children were educated children, and they understood all the explanation that we made. And then they called the doctor aside and told him, "Doctor, for us we're Jehovah's Witnesses, yes. But if you think the blood is going to save our mom, we are also consenting. Please go ahead and transfuse her when she's asleep under anesthesia, and transfuse her." They also signed, and the children signed that we should transfuse if there is need. And the lady signed no transfusion. What happened when we went to theater? The lady had very, very huge fibroid. But what the doctors did, they gave her general anesthesia. So they couldn't remove the fibroids without transfusing. So they were removing, operating as blood was running. And even after surgery, when she was in recovery, they still gave her some good units of blood. I think they gave her about 10 units of blood throughout the whole surgery. And on waking up, they had put a normal saline that was running very slowly. And then they took her back to the ward when she was on IV fluid. And guess what? The lady's life was rescued, was saved. She didn't die. She recovered and was this guy. And the lady was like, "Masao, thank you so much for your care. You see, you wanted to give me blood, but I refused. Thank God he has saved my life without your transfusion." And we're like, "Hey, thank God, Munan." But the children knew that their mom was transfused. So that is the Jehovah's Witness. You find yourself now in a dilemma. What would happen if this lady got to know that we transfused her? Or what would happen if we had transfused her and she passes on and the children know that we transfused and then the mother dies? Wouldn't they say, "It's you who killed our mother? She refused the transfusion and you went ahead to transfuse." And then you say, "Oh, you signed that to transfuse." And then they will say, "Patient's autonomy. If the patient refused, why did you go ahead to transfuse?" So it's a dilemma. And you should always think twice before you act, because if things go bad, you may end up in jail. But we've seen autonomy, patient's autonomy. Patient decides on what to do and makes an informed consent about your plan of management and care. And then the other principle is beneficence, which is do good. Beneficence requires that the health worker does good for the patient. It is the most commonly used principle in the application of care. Whenever you're caring for any patient, a mother, a child, patient in medical ward, please always do good to this patient. It implies that the healthcare team should do positive acts in maximizing the benefits of treatment. And this principle may also apply to stopping futile or burdensome treatment. Sometimes you can find the patient is in stage 4 disease, is dying, is even gassy, and the doctor is prescribing some very expensive treatment for this patient. For what? When you very well know the patient is dying in a few minutes' time or in a few days' time, is this treatment, very expensive treatment, going to change anything in this patient's life? And to make matters worse, that treatment will not be in the hospital. They will be directing this patient or a family to a pharmacy somewhere, and that is that doctor's pharmacy. The drug costs like 500,000 or 1 M per dose, and they'll be directing them to that pharmacy. Are they doing good to the patient? Is the treatment going to change anything in the patient's life? So let's not be so money-minded. Let's aim at doing good for this patient. If you think that treatment is not going to benefit the patient, please advise these doctors. If your doctor prescribed, I don't know, if you're in practice and you know these very expensive drugs,